they always found a way to overcome. They always found a way to make things happen, to rally, to pull together, to do something. A pandemic comes along and you have to pivot, you have to shift. And you're now changing some of the ways you do your work, but it's still driven by that same drive of you got into public health to help people and to improve the health and well-being of the community you serve.
This was really new for all of us to be front and center with a spotlight on us. We had been the wizard behind the curtain most of the time. Everyone knew who we were and were constantly asking us questions.
And then seeing clients and their loved ones losing their jobs and able to pay rent or even put a food on the table for their kids.
As we're getting questions, concerns, challenges, we're connecting people to resources. We're connecting them to the answers for authoritative, evidence-based, science-driven public health information.
Always kind of like tell my clients that, hey, I'm here with you. I'm going through the same thing, but we're here together.
COVID has constantly thrown curveballs at us this entire time. I feel like I'm a better public health professional after all of this. It's been stressful, it's been heartbreaking, it's been emotionally and mentally draining. We've had little wins here and there, and they always seem to come at the perfect time.
We started January of 21 doing vaccinations. We've done a little over 130 clinics.
We had a huge team that was working on those clinics. So neat to be a part of it. We had our own staff from all different areas of public health, not just the clinic staff. We had our fire departments. We had partners from the city of Edina and Richfield who also came as volunteers.
It was not uncommon for people to cry at our clinic, and just that sheer emotion of, I just got something that's going to protect me. When things happened, they did their regular work and they did this, doing events to build well-being and connections in communities that were isolated, whether it was some of our older adults or some of our families with young kids.
I designed the original layout for the Mall of America vaccine site. The state oftentimes would call on local public health and be like, we have the resource, but you know your community.
You have continued to exceed expectations. Everything that we've asked for local public health to do, you have risen to those challenges and exceeded it. Continue to keep moving forward with that grace, humility, and kindness.
I would encourage every single one of my colleagues to take that time to find joy and rest. Then let's get back together and let's show up for the community again.